We're gonna do our head exam with the ears, eyes, nose, and throat. You always want to tell your patient what you're doing before you do it so that they're not surprised. So I'm gonna check your pupils real quick. It's a bright light, so I apologize. Okay, so they're equal and reactive. Now we check for the eye movements. So if you could follow my finger. Good, thank you. All right, everything checks out with her eyes. They're nice and clear, there's no redness, nothing to indicate that she has any environmental allergies, and all of her cranial movements are intact. So next what you want to do is you want to be able to look in their ears and their nose. I do not have an otoscope, so I will not be doing this exam, but we can always examine the outside of it. Of them. I don't know. And what's your other ear? Good, you have 2 ears. Okay. Next, I'm going to examine Savannah's mouth. When we look in the mouth, we want to look at the color of the gums and the color of the tongue. We want to make sure all of her mucous membranes are moist. We also want to notice the size of her tonsils and if we see any abnormalities with that. Usually you would use a tongue depressor with this and a flashlight. Can you open your mouth? Let's take your tongue out. Say ah. Thank you. So everything looks nice and pink and moist. Her tonsils are normal. There's no swelling. There's no extra redness, and there's no extra mucus production. What was I saying here? Thanks. All right. The next step in the head, in the assessment of the head, is we want to feel her lymph nodes. Lymph nodes will tell us if she has any infectious process going on within her head or sinuses. Y'all feel good?